Hello everyone. I'm going to do a little bit of a different video this time, trying to respond to somebody's question that they asked online. So I'm going to start off by saying, first of all, we are all different. All of my patients know that I tend to say that all the time. So when it comes to dry eye treatments, the best thing is to find a doctor that is up to speed, offers a variety of treatments, because we're all a little bit different. The question asked was, do prescription eye drops help? There's a little bit of nuance here. Generally, anti-inflammatory and sometimes anti-infective eye drops can be helpful in certain situations. Those are typically eye drops that you're on for limited amounts of time. So that's going to be things like loteprednol or antibiotics, sometimes some antivirals. Those can be helpful. The vast majority of patients are not on those long term. Now, the other class of what I call chronic eye drops, so that's going to be ones that you're on for years and years and years. That's Restasis and Cequa and Xiidra, and there's a whole bunch of different ones out there. Generally speaking, my experience has been that those eye drops can move the needle maybe 20% for some patients. So in other words, they might notice 20% improvement. I personally, and I've been on, I think all of them at some point, I never noticed a big improvement on any of them personally, but I know that my patients are not me. That's probably a good thing. But most patients, if you notice improvement, it's going to be fairly slight. There are some exceptions to that. The omega-3 question. So yes, I think that omega-3s can be very helpful. I put my patients currently on the DE3, so that's made by a company called Physicians Recommended Nutraceuticals, I think is the name of the company. I personally take those. There's a couple of different options. They have a liquid and a capsule form. Anyway, that's kind of my thought. Generally, if you are seeing a doctor that has only talked about warm compresses and eye drops, you're not seeing a specialist. Anyway, I hope this helps. Again, if we can be helpful, please reach out to us at the clinic. And if you're unable to travel, please try to find a good local specialist. Thank you. And remember, you have two eyes and one of them's not just a backup.